Hello, and welcome to the first event of the year from the Housing and Services Resource Center. We're really thrilled to bring to you today the Ohio Solutions Office Hours, how CBOs can sponsor, develop, and co-develop affordable housing. Next slide. Welcome and thank you. My name is Alicia Anderson. I'm a management and program analyst with the Office of Interagency Innovation here at the Administration for Community Living. For those of you that are not familiar with ACL, I encourage you to visit our website at acl.gov. I also want to say a special thank you to our interpreter for being here with us today. Thank you, Kelly. Next slide. So again, we're so deeply appreciative that you've made time available to join us. So thank you for joining the Housing and Services Resource Center for a three-part series featuring partnerships in Ohio between the housing sector and the aging and disability networks. These collaborations are expanding options for older adults and people with disabilities to live in their communities with access to supportive services they need. So this session, you should walk away with an understanding of how CBOs can sponsor, co-develop, develop affordable housing. Next slide. But before Joe, Justin, and Duana get started, I gotta go over some Zoom instructions for you. So audio options. We ask that you use your computer speakers or you dial in using the phone number, your registration email. So we ask that you please stay muted unless we call on you. Also, the chat function is made available for you throughout this meeting. You can even throw something in there now just to test it out. To ask a presenter a question in the chat, please include the name. For example, question for Joe, so that we can know who to direct the question to. The raise hand function has been made available for you. So we ask that you use the Zoom raise hand function to ask any question. And you don't have to wait until the end to ask a question. This is intended to be absolutely interactive. So at any point in time, if you want to ask a question, whatever that question is, raise your hand and we'll call on you. So this meeting is being recorded. So by staying and participating, you're agreeing to that recording. Thank you. Next slide. We are super thrilled with the launching of the Housing and Services Resource Center. It is an opportunity. If you have not had time or chance to visit the Housing and Services Resource Center, we encourage you to go to acl.gov/housing and services. If you visited the site and you've made plans to go back but haven't gone back, we ask that you really revisit the site. There's a wealth of information there for you. Next slide. So HSRC, that's what you'll hear from government speech, the acronym, the Housing and Services Resource Center, will facilitate a federally coordinated approach to providing resource, program guidance, training, and technical assistance to every sector that makes community living possible, to the disability and aging network organizations, to state Medicaid agencies, to mental and substance use disorder service providers, homeless shelters, public housing authorities, and housing providers. Here in this space, we're working together to make community living possible, and we're here to facilitate and support you along the way. Next slide. So what's the goal of HSRC? Well, we're working to coordinate and leverage technical assistance, training, and research efforts of HUD and our HHS partners, that being here at ACL, CMS, SAMHSA, and ASPE. We intend to reach a broad audience of the aging, disability, housing, and homeless network and stakeholders. We intend to facilitate state and local partnerships between housing and service systems. And we intend to assist communities in leveraging new housing and service resources, including the American Rescue Plan and the Build Back Better. Next slide. So what to expect for this next hour? Well, let me hurry up because I know you're not here to listen to me. So what you'll get is learnings and discoveries as it relates to methods that stakeholders from different sectors have used to begin to develop partnership to expand affordable housing and access to community-based services. You'll get practical tips, real-world examples, boots on the ground approaches of what works. We're asking that you participate in the polling throughout this session because it will be used to inform the upcoming sessions. So please participate. Next slide. So how is this going to look? How's it going to work so it could make things possible? Well, you should expect a short presentation. We try to keep it brief because after all, we're not here to talk to you. We're here to talk with you. So after that, you should have a very long period where there'll be a question, a discussion, and opportunity that allows for peer-to-peer sharing. So enough from me kind of mumbling on. Let me hand this over to Joe to move this forward. Thank you.
Thank you, Alicia. I'm Joe Ritchie. I'm the CEO of Community Building Partners. And with me in this panel discussion or conversation is Dwana Patton, who's the CEO of Ohio District 5 Area Agency on Aging, and Justin Moore, the Vice President of Planning and Program Development at the Area Office on Aging in Northwestern Ohio, covering Toledo and the surrounding counties in Northwestern Ohio. Let me tell you a little bit about my co-panelists. Dwana Patton has an MBA. She has been with the Ohio District 5 Area Agency on Aging for 27 years. She started as a young child and as CEO since 2006. She spent her career in executive leadership in the nonprofit sector, ranging from workforce development to aging. She has a lot of talents, including as a certified executive coach, but one talent I've seen in action is her motivational leadership with her board of directors and in her community. And we're going to tap some of that leadership guidance today to think about how to build board support and community support. Dwana serves on numerous local, state, and national boards where she contributes her knowledge of aging, nonprofit management, leadership, and business development. Most notably, she's on the board of the Ohio Association of Area Agencies on Aging, the U.S. Aging Board as a Region 5 alternate, and she's been appointed by the governor to the Ohio Housing Finance Agency for a 6-year term starting in 2018, and most recently has been nominated as chair of their multifamily committee, the one that guides all of the programs that deliver housing allocations and grant funding from the state level through to local communities. Justin Moore is with us, and Justin has been with the Area Office on Aging in Northwestern Ohio as VP of Planning and Program Development. He's been with the area agency for 18 years. He's responsible for $10 million of the agency's budget for service provider contracts, support of family caregivers, strategic planning, community partnerships, call center operations, marketing, and more. His leadership has earned him both national and local recognition, and he continually shows mastery in a wide range of skills, including promoting housing under the leadership of CEO Mrs. Billy Johnson in the 9 county areas. And I'm Joe Ritchie. I'm the CEO of Community Building Partners. I've worked in the community development arena for 42 years. I've been working in housing for most of that time, and in that time, I've worked on over 170 projects, housing projects, done over 400 grants for nonprofit organizations supporting housing and community development, and been involved in over 9,000 housing units. So in my professional life, I've had the opportunity and the pleasure to work with a lot of nonprofit organizations around the country, from the formation stage up until their ascendancy to the premier community development organizations within their respective communities. So if you can go to the next slide. So with that, we have a couple polls that we want to start with. In this first poll, we really want you to tell us about your organization. If you're an area agency on aging, if you're a center for independent living, another community-based organization, if you're a housing developer, owner, or manager, a representative of a public housing authority, a tribal nation or organization, an investor, or other. And if you can fill that poll out, I'll give you just a minute to do that. We'll get the results real time, and that'll help inform our discussion and help you know who else is at the table with you. So those are the first poll, and those are your selections.
Joe, we suggest that we just go ahead and move on.
Okay.
And then we can come back to this.
Okay. So well, here's we're developing our poll results right now. Do you want to go to the second poll and do that and go ahead and fill that out? So on the second poll, we'll go back to these in a moment, but your level of engagement, just gauging your level of engagement in developing housing, whether you have an interest in exploring the possibility of developing housing, if you've not developed it, but have taken steps to pursue it with yourself or with other stakeholders, or the third category, if you've actually developed affordable housing, if you have that experience. And that'll help guide a little bit of where we're going. Can you go back to, can we look at the results on the first? Well, so this is pretty clear. Going to the second poll, about 61% of you are interested in exploring the possibility. 28% have not developed it, but have been pursuing it with other stakeholders, and 11% of the audience has developed affordable housing. So that gives us a broad range of people in the various categories, and an opportunity for us to learn from each other. Can we go back to the first poll to get the results? So 43% of you are area agencies on aging, about 7% are centers for independent living, and then there are a few representatives of public housing authorities, and then other, that's a mystery, but 36% of you are in that category. So we'll have to explore that a little more, and you might have to come forward and tell us about what your experience is. But let's move forward to the next slide. So the roadmap really is, I'm going to present the need for affordable senior housing and the opportunity for community-based organizations. And then we'll be talking together about how to get started promoting housing in your community, and then specifically some opportunities for smaller community projects that are given rise by the historic American Rescue Plan funding that's being distributed now through every city and county in the country. So, so that's basically what we'd like to cover. The next slide. So I think from the poll, all of you are familiar with how housing is a social determinant of health, but it is but one social determinant, and most of you are engaged in other aspects of making those health determinants. It's often cited as the most important social determinant, recognizing the ways in which a lack of housing or poor quality housing can negatively affect health and well-being across populations. So it is among many, although it turns out to be very significant. In the next slide. So these are the three biggest expenses in retirement. Thank you, Justin, for producing this, but housing, transportation, and healthcare. Most seniors are concerned about healthcare because of the uncertainty of it. But we have a healthcare system in place for seniors. We're really lacking it with transportation and housing. And as the slide shows, transportation costs represent about 16% of retired persons' expenditures, and healthcare represents 13%. In the next slide, just to underscore that, over 1 in 4 older adults nationally live in unaffordable housing. So housing is considered unaffordable. The standard that used by the Department of Housing and Urban Development is if more than 30% of household income is used for housing and utilities. Go to the next slide, please. So that housing burden is becoming more dramatic all through the country. More than 2.6 million older renter households pay more than 1/2 of their monthly income for rent. So that is an extreme burden on them. And increasing numbers of older adults are forced out of their homes or end up in homelessness. Sometimes because of a health crisis, they have been admitted to a hospital or they're in a rehab center and they've lost their opportunity for housing, and it's very hard to locate new housing for them. Some of you are involved in that effort right now by searching for referrals for housing and trying to find that appropriate place for seniors to live if they've lost their housing. Can you go to the next slide? So this is a poll. We want to look at your primary interest in exploring ways to develop affordable housing. So to develop new revenue stream of funding for my organization, I recommend that you press that, because I think it's really important to align the production of housing with the provision of the services relating to the housing. And the way to do that is, as a sponsor or co-sponsor, you can retrieve some of those fees that you use to provide the supportive services that are so critical in health determinants. To increase the supply of housing for persons with disabilities and older adults and in the community, to increase the quality of housing for persons with disabilities or other. So here are our results. 43% of you are considering it as funding source to help support what you're doing. 74% of you have expressed the desire to increase the supply of housing for persons with disabilities and older adults in the community. 30% to increase the quality of housing, in the community. So that kind of covers it, but it looks like the vast majority of the participants are concerned about the supply of housing, including what is recognized as a dwindling supply of affordable housing in each of your communities. So I think that helps us frame who is sharing the conversation today. Can we go to the next slide? So this is where we really need to start our conversation. The key components to addressing housing in your region. And there are 3 things that I think the 3 of us are mostly concerned about: building leadership and board knowledge of critical housing needs and ways to get involved. So that's really bringing your organization along in this effort to recognize the need and bring yourself to the table for discussion and activation. Capitalizing on existing relationships or get to know potential partners and craft a shared vision. And then engage key community stakeholders and decision makers in support. So next slide. So we have some examples that I'm going to ask each of my co-panelists to participate. The District 5 Area Agency on Aging, the Ritter's Run project in Mansfield, Ohio. It's a medium-sized entitlement community, about 55,000 or so people in north central Ohio. So that's an example. There are many of those communities around the country. And in the Northwest Ohio region, an older urban area, Toledo, projects under consideration that Justin can talk about. And then I'll share an experience with another Buckeye Hill Support Services. It's a newly formed 501c3 that is participating in the 9% tax credit program in co-development. Next slide, please. So Dwana, perhaps you could walk us through the Ritter's Run project, and we have your slide that shows how we brought all the partners together. So if you could share that with us.
Sure, thank you, Joe. Happy to talk more about Ritter's Run. I'll start by first saying that this project at the Ohio District 5 Area Agency on Aging did not happen by accident, although it was not a a clear vision on the onset. We were actually sharing and talking about an opportunity to build on our property here where our corporate offices are. And that particular vision started with a commitment from our board and our leadership here at the organization that says, you know, we recognize the value of housing. We also recognize that it's a huge need and there are gaps in our ability to provide the safest and best place for people to get their services. And so what actually happened, and you'll see it here in just a few minutes, is by having a vision to develop housing, Ritter's Run came to fruition. And it came to fruition because we were willing and able to find a seat at the table and talk about what we wanted to do in the world of housing. And so while we were really thinking about what we might be able to do on our already owned property, the land bank came to us and said, would you be interested in looking at what properties we have available and consider being a partner in revitalizing other areas of our county? Of course we would. And so we sat down with the land bank and identified a fantastic property that is in an area that is being revitalized by other businesses, including our major health system here in Richland County. Next, we had a landowner who owned one of the decimated properties there in the community that had been succumbed by fire about 7 years ago. So it was an eyesore. It was also unsafe for the neighborhood. So he was willing to gift us that property. And in return, we demoed it and it really added value to our project. Financing is always the most scariest part of any of these projects, but it shouldn't be, because there are so many creative ways to figure out how to finance a project like this and keep the rents affordable. Lucky for us, again, being partners and having relationships across different sectors of our community, we learned that the city had some unused home funds that they were going to be making available. So we sat down with them, shared our vision, and worked with them to secure home funds from the city. Our construction and the permanent loan is from a local lender here in our community. And then we've also been able to leverage funds from our local foundations who are willing to support some of the on-site amenities for our seniors. If you go to the next slide, you will see here how this all came together. And right there at the top, Praxia Partners, Joe's group, we have been fortunate enough to work with Joe and his team well before our vision of housing really formed. Joe helped us get our board members knowledgeable, interested, and confident that our agency as a community-based organization could and was well positioned to actually develop low-income housing across our 9-county area. So others are, again, those that have been mentioned. The home funds totaled $740,000. So you can see, how sizable that grant was, that we didn't have to seek tax credits or other types of grants, that this allowed us to keep the rents low, along with the Section 8 vouchers that we've received or will receive from the Richland County Metro Housing. So it's been an amazing project. We have broken ground, but on hold with any further construction due to the winter, of course. But we are very excited that this will result in 12 units for seniors in a very ideal area where we can help others revitalize the community, and we will bring services and supports to the individuals that live there and make sure that they can live independently for as long as possible at Ritter's Run. We now have, just to be very transparent, as you heard, we have 12 units. It's not a lot, but it is progress and certainly a catalyst for us to do this in future places and in partnership with individuals like you see here. We have over 100 people on a waiting list that are interested in living at Ritter's Run. So if that doesn't tell you what needs are out there, I don't know what does.
So Dwana, there are a couple things on this I'd like to ask you to call attention to. And one of those is you were supportive of others who were producing affordable housing, specifically another nonprofit that didn't have the strength of your organization or the depth, and came to you and and actually merge their organization into yours so that you could carry forward the stewardship. And also in announcing yourself, that is by going to your surrounding communities and announcing your interests and capabilities, other developers were directed toward you, and you were able to successfully develop in a co-development setting within your region other housing. Maybe you could add a little bit about that, because it's an interesting journey, starting with your conversation and advocacy and ending with a pretty fluid response.
Yep. So I think to Joe's point, entry into, housing development can really happen anywhere, and it can come very unexpectedly. So as Joe had indicated, we actually acquired a nonprofit that was a co-developer in one of our counties on a beautiful property for the seniors. So we acquired their assets and now are the co-developer working with the management group and providing services and supports to the seniors there. And then most recently, because we have put it out there that it is a vision. And again, it's having that clear vision that's shared, not just by me, but by my board members and other staff. And the more people that talk about it, the more it gets out there. When a developer came to one of our local communities and pitched their plan to develop, the city said, that is great, but you need to sit down and talk with the Area Agency on Aging first. And really, the city wasn't willing to give a commitment of supporting or being on board until they talked with us. And so we were able to work with that developer and add the value proposition of service coordination and being their co-developer. So we actually get paid by the project managing company to provide service coordination on site in that facility. So, again, there's many ways to get involved and to learn and to grow, but it does start with being at the table and being confident in what the vision is and clear in that area. You're muted, Joe.
There was a question while you were talking, is this for seniors only? And it is senior housing, but there is a disability set aside within that community that you were referring to for some percentage of units. I think it's 20% of the units.
Yeah, so Ritter's Run is seniors only. The one we acquired is senior only. The other one actually is multifamily. And so, and that's in Ashland County, here in our region, and which has been a really great opportunity for us because we have very skilled staff who are integrated in the communities. And so now we're working with families and helping them with, whatever their needs are, whether it's, finding work, finding schools, transportation. And we've actually, what the value proposition there, someone might say, well, you're an aging, you mainly provide to seniors, but what's happened is it's given us another population to connect with. And lo and behold, many of these young families are also caring for either a grandparent or a parent. And sometimes their pain point or their challenge to maybe gainful employment or taking care of their own family is the fact that they're also caring for an elderly loved one. And we've been able to come in and talk about, what services and supports we can provide. And so it's really been eye-opening, and it's just allowed us to filtrate our mission across many sectors of many communities.
So Dwana, while you were talking, there are a couple other questions relating to rents. Rents compared to comparables in the area, and Ohio is more affordable than many of the locations that participants are enjoying today, and less affordable than many. But in this particular setting, the rents are in the range of $480 to about $615. They're 1 and 2 bedroom units, but those rents include all utilities. So this is a master metered community. So all utilities are covered in that. So translating that to a net rent, that makes it affordable at between 30 and 50% of median income in these respective communities. I don't know if there were other questions about, oh, I like Tammy said, wow, those rents are amazing. And it is true and part of this is that in evaluating these, we are solving for rents not in year 1, but we're actually looking at year 15 and 20, recognizing as we have to that incomes do not rise very quickly. In fact, they haven't risen at all, adjusted for inflation, but operating expenses do. So we have to think about the trend of this and design units that are that have long useful lives and also are super energy efficient. So that is the key to it. And the willingness to pay for utilities is an indication of the confidence we have in the design, the green design of these units, that they will operate at a very sustainable, efficient level.
Joe, I saw another great question in the chat that's probably you can answer, but it was, now I can't find it, but it was basically asking why there wasn't consideration for mixed use, where we had some, higher rents and such. Now I know for Ritter's Run, I think we didn't consider that because it's a small project.
Yeah.
And we wanted to really tap into the others first, but I think maybe that might be something you want to address.
So thank you, Duana. The mixing income, or income averaging as it's called with tax credits, is possible. And depending on the area you're in, it can be really a valuable delivery system. Essentially, the higher rent units deliver cash flow that can be used for operating expenses, and you're able to have a corresponding lower rent set aside. We've done that with the Columbus Metropolitan Housing Authority, where public housing units are combined with market rate units, and the market rate units carry the project so that the public housing units can be very inexpensive for residents. So it's possible to do that. I would say that that's most appropriate in urban areas where the lift of market rate units is so significant. In the case of the Columbus Metropolitan Housing Authority, the range of rents is from $300, which is the public housing average contribution at the community, to $2,300, which is the highest market rate rent in the same neighborhood. So in the same community. So in that case, those market rate rents are actually carrying several units of affordable housing because the rent differential is so great. So I'd recommend that in an urban area where the underlying market rents are extremely high, and you can really capture that and deliver an internal subsidy. See, there's another question about affordable, but also helps with financing the carrying costs and original loan. This deal would certainly cash flow well. Well, it does in a sense. What we try to do on these is deliver a cash flow that exceeds the lender's requirements, but that is then devoted to service coordination. So it's kind of important. We're actually rendering the project. You make all your promises to an investor if an investor is involved. You meet all of your obligations to the bank and other compliance requirements. And then when there's surplus money, when the nonprofit is in control of it, they capture that money and can recycle it back into the service coordination. So yes, it's intended to have cash flow, and it is also intended to deliver funding for the service coordination. Moving forward, Duana, sort of a parallel opportunity is what Justin is working on in an urban environment with a different group of collaborators, also very creative, using that same theme of creative collaboration, getting yourself at the table, talking openly about what your desires are and intentions and how to put things together. Justin, this is the Thurgood Marshall. We were on the call earlier today on this, but maybe you could just walk us through the various partners that are assembling for this property.
Yeah, absolutely. Thanks, Joe. Just as a point of background, Joe had alluded to our CEO, Mrs. Billy Johnson, being a strong leader in this whole area of affordable housing development. That started about 35 years ago when she saw a need for more affordable housing in some of our rural parts of our 10-county service area, and built 3 affordable senior apartment complexes in those regions. We now are working on pursuing 3 new affordable senior housing projects, this being one of those. So Toledo Public Schools has some kind of surplus properties that they have not been utilizing or have been underutilizing. One of those is this Thurgood Marshall building, which used to be their old administration building, but has been sitting vacant for several years. So we're partnering with Joe Ritchie's Praxia Partners organization, NeighborWorks Toledo, which also is a really great partner locally in Toledo, but also has affiliates across the country. KeyBank for the financing piece. City of Toledo, again, this is kind of what the City of Toledo with these American Rescue Plan Act dollars are coming to the region has characterized as a once in a generation kind of opportunity. They've earmarked 16 million of their American Rescue Plan Act funds toward building affordable housing. So that just the reason why that's so important is because of the ability for those funds to be able to make the rents more affordable to the end individual who ends up moving into the apartments, you know, using kind of some somewhat arbitrary numbers to illustrate the point. If we had a property that built this without any tax credits, without any City of Toledo ARPA funding and the like, the rent might be $1,000 for that individual that moves in. By getting the City of Toledo ARPA funding, that might reduce the rent to $800 for that individual. By getting the Ohio Housing Finance Agency 4% tax credits, that might reduce it to $600 for that individual. So this is a really unique opportunity we find in front of us with these ARPA fundings coming to different municipalities throughout the nation, and affordable housing development being one very, very good use of those funds. So now is really a great time to explore these opportunities that exist, again, across the country to build affordable housing, and for your organizations to be a part of that. Lucas County Metropolitan Housing has project-based vouchers that they can also provide for those very low-income individuals, so that moving in these nice new facilities that are accessible, that are beautiful, and that are affordable is really a viable option for them as well. So that's just an overview of the different partners that are involved. This is a great team with excellent partners, and we're super excited about this opportunity to move forward with them.
Thanks, Justin. And so this is 78 units, 42 of them are in a historic school building, 36 units would be newly constructed. And then because of the strong service coordination component of this, we'll have a lot of facility space for the service coordination for physical therapy, occupational therapy, congregate meals, and the other kinds of wraparound services that can be provided in the community. And that contract for the partner, the Area Office on Aging, is a 15-year contract. It's relatively large. To put it in perspective, it starts out at $80,000 a year for service coordination, is indexed at inflation, and is a 15-year non-cancelable contract. So it is actually the deferred developer fee on the project cycles to the Area Office on Aging annually, and then those funds are cycled back into the project for service coordination. There's also a developer fee paid up front, but that long-term commitment is what assures those other health determinants get integrated fully and completely in the housing. So next slide, if you can. So we do want to talk a little bit about the American Rescue Plan, because these funds are being delivered now. Half of the funds have already been delivered to your local jurisdiction. Every one of you is in a community where American Rescue Plan funds have touched, and there's some local determination at the city or county level, or at the state level, for allocation of funds. Housing, especially for folks at risk of homelessness, and housing in qualified census tracts. Those are distressed areas. They're usually the poorest areas or near the poorest areas of your community. They're expressly permitted to use ARP funds for that purpose. So I encourage you to have that dialogue with local government about how they're planning to spend those funds, and if those funds can be devoted to housing that you think is important in your community. The new rulings on this that just came out January 7th really align with the home program, the federal home program. So the kinds of restrictions that are expected to be put in place on these would be the things that you see in the home program. So long-term affordability, land use restrictions, limitations on per unit expenditure. So if you follow those guidelines of the home program, you really can focus dollars into the kind of housing that's needed. And the ARP funds can be used, as we're proposing to do with the Thurgood Marshall site that Justin just described. They can also be used as a replacement for home funds, or in addition to home funds, the way Dwana is using it at the Ritter's Run project. So I encourage you to think about that, how to proceed with that. On the next slide, if you can advance it, this American Rescue Plan model basically is a pie chart that shows where the money is. 67 in this model, Ritter's Run, if you take that 12-unit project, if 67% of the money were ARP funds and 33% were a conventional mortgage, you would have affordable housing. So you can, and you can do it on an infill site, you can do it on small projects, you can do it on larger projects. It's literally two sources of funding: your local government committing dollars to affordable housing, and a local lender willing to underwrite that and making a solid commitment to affordable housing with supportive services. So I know we have some questions.
Joe, this is Dwan. I've kind of gone through those questions. I just noted too that I don't want us to overlook Wendy Byerly with the Independent Living Center was asking if consideration would be given for someone with disabilities, or must they be 65 and older? And I think that was related to the Ritter's Run. It is a 60 and older community, and there we won't. I don't know how we'll actually prioritize given the number of people, but it was written for anybody over the age of 60. Yeah. And Joe, I'm going to look to you because you just helped us solidify that contract for those home funds.
Yeah, and so,
and then maybe even address, different ways that we can prioritize based on disability.
So you bring up a really good point. These units are single story, no threshold, ADA, fully ADA compliant units. This same exact model, and I'm happy to share the model with you, could be used for a disability community. So you could earmark it, you can designate it, you can have it as a set aside, you can sponsor it. So you can do it in combination, or you can do it as a standalone unit. There's a question, let's see. Why couldn't ARPA funds be distributed directly to the AAAs to assist in generating affordable senior housing? Local governments may or not have an interest focus on the needs of older adults. Well, in essence, we are asking for that. And that would be true for the SILs as well. You're asking for a dedication of funds to specific projects. The grant beneficiary is the entity that is sponsoring the project. So it's not that the city is designating the funds and meeting the home requirements so they can report and satisfy their audit requirements with the federal government, but the dollars are actually being used for the housing. The ownership of that housing is the sponsoring entity.
And Joe, just to add on to that, there's different organizations that have received these ARPA funds. The city of Toledo, for example, in our region has received ARPA funds. Our agency, our area agency on aging, has also received some ARPA funds through or from the Ohio Department of Aging. Those ARPA funds that we received have certain intended uses of them that is different than the city of Toledo's, the intended uses of their ARPA funds. So for us, the only services that we could really do directly, or any uses of those dollars that we receive directly, that we could do directly, would be case management, information referral, and outreach services. By default, those dollars are intended to be contracted out for services like home delivered meals, home care, medical transportation and the like. So anytime that we wanted to use any of those dollars for this purpose, any of those ARPA funds that we receive for that purpose, we would have to ask the Ohio Department of Aging for a waiver to essentially use it for that purpose. And we would need their approval of that request in order to use the ARPA funds that we received at our area agency on aging for this purpose of developing affordable senior housing.
So thank you, Justin. That's really important, the flexibility of those funds. And again, being at the table, talking about it, expressing your interests, and being responsive. I want to highlight another project that I'm involved in that involves the Buckeye Hills Support Services. And if you can flip forward a couple of slides to that Buckeye Fields Apartments, I'll describe that because there's a case where ARPA funds, yes, thank you. ARPA funds are used as a part of the capital stack. This project is interesting because it's a council of governments. It's in Appalachia, very low income area. The target rent, the entry level rent for set asides is a $347 per month, including all utilities and broadband. So it is an extremely poor area. And to do so, we combined 9% tax credits from the Ohio Housing Finance Agency, a competition for that, success in a grant from the Federal Home Loan Bank under their affordable housing program, a $200,000 grant of ARPA funds from the county. It's on land that is leased for 99 years from the Washington County Commissioners, and using a program that goes all the way back to the Tennessee Valley Authority, solar power generated on the site from the rural rental program, which reinvests the profits of the Tennessee Valley Authority to innovation. We have a side-by-side development of solar power that will power the entire community, 64 units, 32 ranch-style duplexes on a campus with one community building. And the Buckeye Hills Support Services is a newly formed 501c3 organization that was highly desirous of getting housing in their community. It was formed with the help of the Buckeye Hills Regional Council, which is the Council of Governments. It had to literally muscle its way forward because as a new 501c3, it took a while to get respect. But they did that with sheer velocity of their advocacy. The county commissioners were behind them, the city, the local state representatives. They competed at every level successfully for this project. So in the process, the ARR funds, the ARPA funds, are a grant to the Buckeye Hills Support Services. The lease of land is 65 acres. They're using about 20 of it for this. So they actually have more capacity in the future. The solar power system has investors involved in it for a 10-year period because they're using tax credits as well. But when the system is paid off, it is transferred to the Buckeye Hills Support Services. So they not only are building capacity in housing, they're building capacity in energy as well. So it's just an example of, again, that sort of doggedness, perseverance, flexibility that is needed to proceed through that. Andrew asks, what's the total cost of the capital stack? The total cost of the project is $12,200,000 for 64 units. So there's been a couple other comments here that are really important. The state of Colorado has, let's see, DRCOG has gotten permission from the state of Colorado to use some ARPA funds to their AAA for emergency housing vouchers for older adults, but doesn't extend to actually building housing. So it's really thinking about that. It's great to have that short-term assistance, but to produce the housing that is committed for the long term, is a more permanent solution. So if they've started at the level of housing vouchers, maybe going on, and I think that those are available for like a 3-year period, perhaps, is the way it's set up. To ask for them to think more expansively about devoting housing to create a permanent solution. But the fact is, once they've done the first step, there's the opportunity to sit at the table and think about how to expand that role.
So I might add to that too. If you haven't already, obviously there are likely conversations going, on in your communities about how the ARP funds will be allocated. And find a friend, find a colleague who can get you to the table. What we have learned here is there are so many priorities. I mean, you can imagine, municipalities now having these dollars. And what we've been able to do creatively is, not just focus on housing bricks and mortar, but really looking at every priority and providing, a summary or a value proposition that says, and if housing is part of that, then this. So for example, revitalizing some corridors in our area near hospital systems, it could take the shape of everything. But, housing and housing stock also feeds into the success of that healthcare system. So it's just, finding that story to tell and making it a win-win for various priorities of ARPA funds.
So there's your theme, Dwana, win-win. You're always posing it that way. So we have a fourth poll. We'd like to quickly do that, and then we'd like you to turn your cameras on, if you will, and ask any other questions. I want to make sure we're covering as much as we can. This fourth poll really relates to future topics. Based on what you've learned today, what types of information would help you take the next steps in developing affordable housing and services in your area? And so I'd like you to do that. We'll see the results, and we can, if you can then turn your cameras on and share with us. I know that Dwana, Justin, and I have all committed to trying to answer questions you may have after this, or questions that come up tomorrow when you're thinking about this. And I think we would do that through the portal that's been established. So the Resource Center, we'll happy to share that. So let's look at the results here. Getting buy-in from the board, that's a big one. Building community support, identifying and leveraging available funding sources. That's the #1 item. Identifying and securing commitments from potential partners and decision makers. That's also pretty high up there. And understanding local market needs and potential customers. So addressing that, identifying and leveraging available funding sources. There are quite a few resources that are available at the Resource Center that kind of help guide you through at least the opportunities to keep you at the table. But I would say, starting with the ARP funds, start with your local communities to talk about that. The allocation process in each state for the affordable housing includes both trust grant funds and the allocation of tax credits. But at that local level, decision makers can pick up the phone. Post-COVID, they can go sit down together at a round table, and if they, as Dwana said, if they've addressed it as a problem, then move right to what are the possible solutions. So I don't know, in these last few minutes, if we can have the people on the camera for any other questions. Thank you.
And people can click on the reactions button and raise their hand, right, if they want to ask questions.
And Joe, while we wait, just a really quick question for you, Dwana and Justin. If you can talk to us a little bit about the best resources for determining housing needs in the community.
Most communities, every community that participates in revenue sharing from the federal government has some kind of housing assessment write-up that they've done in response to their grant program. So you can start right at the local community. There's some sort of analysis that's been done. The housing authorities in your community publish the utilization of their Section 8 program. So if you see a lagging utilization of Section 8 vouchers, that is an indicator of distress. That is, they have a program that works. There are people that need it, but they can't find the housing. It's either too expensive or too low a quality to meet the minimum standards that are required from the housing authority, or both. But when I look at utilization, that tells me the level of distress that the community is undergoing. So those are quick measures to sort of guide you to the next part of the conversation. Dwana, do you have anything to add to that, or Justin?
Yeah, I would just, you had mentioned definitely ones that we rely on. Of course, we rely on the Ohio Housing Finance Agency, their needs assessment. And interestingly enough, because I am so passionate about reading anything that jumps out that could relate to housing, I have actually found that because it is such an impact on many, many industries and a social determinant of health, that in some of our counties, it's also showed up on their health needs assessments. And so again, it's just framing the story that makes the vision that the community-based organization has a win-win in multiple sectors. And then it is just amazing where, where funding streams are identified that you might not even have thought about.
Thank you. Other questions? Anybody have their hands up I'm missing?
Jenny Jarvis, please unmute yourself. Thank you.
Thank you. I had a quick question, more of a clarification question. I want to make sure, I don't think I heard it correctly, but for the art funds, you had indicated that, two of the reasons to use them for housing would be a risk of homelessness and then the census tract. Is there other opportunities to use the art funds to support affordable senior housing outside of those? I'm just trying to understand the guidelines for housing use at the county or municipal level.
So in general, and I can answer this. In general, the guidance is very broad. So at risk of homelessness means anybody who is rent burdened. So all that population that is rent burdened, because it's very difficult to sustain using 50% of your income for housing. So it doesn't have to be that they're actually on the streets, but the risk is that they're burdened. So that's a pretty broad calculation. You can be outside of a qualified census tract and devoting money to housing if the characteristics of the area you're working in have similar demographics, or you're meeting a similar need. The default position that they put in the guidance from the Treasury is the assumption that if you're in a qualified census tract, a distressed area, the people in that census tract are more vulnerable to COVID because they're essential workers, they're ill-housed, there are other conditions that would make it more difficult. So they made a really broad brush approach to dedicating funding to housing.
Okay, thank you.
Well, any more questions? I know that we're at time, but just wanted to make sure that if there's one last burning question that we allow for that. Well, thank you so much. If you could put up the slides, Maya. We have another 2 sessions coming up, so there's more opportunities for you to think about questions that you probably wanted to ask, but for whatever reason you held back. We have a session that's scheduled for Tuesday, January 25th, and that's tied to the service coordination models and sustainability. And we have a session that will be Thursday, February 10th, and that's related to cross-sector partnerships. Thank you. Please come prepared to ask your questions. This was the first of many sessions. We started with this office hour because our goal is to engage with you, for you to tell us what's working, for you to share with us anything that you want to bring to the table. And so if there's something that you would like to see as we're moving forward, if there's something that you want us to put in for the next 2 sessions, please let us know. We're here to work with you and to provide you whatever it is that you need. Please email us at hsrc@acl.hhs.gov. And again, thank you for taking your time to be with us. Have a great day.